Welcome to our continuing series on understanding the borderline parent, how to heal your childhood wounds and build trust, boundaries, and self-esteem. I'm a licensed clinical psychologist, and I grew up with parents who struggled with this disorder, among others, and it truly has shaped my entire story, my childhood and my life, and it is a big reason why I wanted to share here. Where it's been tricky is that the historical pathologizing and frankly demonization of borderline prior to the last, I would just say, couple of years left us with a really lack of awareness and knowledge about what it can often look like, because it has been so stigmatized to look like this one certain version. And the truth is that borderline, I believe, and the amount of criteria it takes and the spectrum, the combination of possible criteria is quite extensive. And so I think that we've missed out on not only supporting those who need treatment and help, but also on supporting the family or friends or loved ones of those who struggle. So I feel like I'm always walking this really difficult line here, because I feel like I get criticism for not going too far into what it feels like as a child. I get criticism from those who have this disorder and feel like I am adding to the stigma, and it's a real dilemma. I don't know how to talk about it as a child of parents who struggled, one, with extreme trauma as a childhood, which is very much makes a lot of sense to me from my father, for example, to my mother, who didn't seem to have anywhere near the same experiences. But that doesn't mean she didn't have her own traumas, genetics, biology, whatever. But the heart of this disorder for many people is the eggshell nature of what it feels like, and how that plays out in your often lifelong chronic hypervigilance and overreading people and never knowing what to expect, and really developing what I believe is a trauma personality that forced you to rotate around that parent. And so unless we're being honest about the things that they might say or do if they are untreated, I honestly don't know how else to talk about it in a way that I truly believe needs to be shared. And yet, earlier this week, one of my videos from a few years ago, which has been a long process of learning how to make videos on YouTube, and I'm still doing it, from me talking super fast to, editing to the camera, it's been a lot. And since I am, 55 and I started this journey, I had never posted publicly on really anything. I had never talked about my issues, my story. But one of those videos on how to spot the traits of borderline was somehow being pushed on YouTube. And I'm grateful for that, except for it opened up a lot of really difficult, it's like the floodgates sometimes of people saying things and posting things or emailing me just out of nowhere. I typically don't get a lot of negative. I'm going to get some, of course, and it almost always is around borderline. And so my initial reaction was to stop doing this series, and I literally almost didn't post yesterday's video. But then I decided that as the day wore on, I was also in some kind of an emotional headspace that was probably, I was tired, that it really is important to me to share this information. And it's not fair to people who really deserve it, whether they grew up this way or they are struggling and they're not necessarily aware of how it plays out. Or you had a parent like this and you have traits and now you don't want to, repeat those. All that being said, even me saying that might stigmatize borderline further, but the truth is this area is difficult, because I feel like we can talk all day long about narcissism and how terrible narcissists are, when we know that a large part of the trauma response can be narcissism for people, right? We know that that disorder can also be highly trauma related. But there's a certain dynamic, and I think it's because people who have borderline often have this deep well of love and intensity and feel so misunderstood, and often don't understand because they might at times lack the real awareness and insight of how their untreated, sort of unmanaged behavior can play out. And so it feels extremely personal, and it makes sense when you look at the heart of that difficulty, I don't even like the word disorder, compared to narcissism. But the truth is, we need to be able to talk about the experiences children have when parents are unsupported and untreated, and that has been historically the case. And the reason why I talk a lot more about mothers is not because I don't have a lot of daddy things to talk about, but is because more often than not, the person in the primary attachment caregiving role is historically a female. And then we can talk about why women struggle so much and why parenting is so hard and the nature of trauma for women. Like, it doesn't come out of nowhere. So I also don't want it to be like, well, you know, this thing around moms is bad because I'm a mom of 4 and I've struggled being a parent. It's the hardest, it really is the hardest job on the planet. And so, at least from my perspective, especially if you're trying not to be the parents that you had, and in a world that tells you, do this, don't do that, there is a lot of mom shame. And so I struggle with how to walk that line where I'm talking about these wounds so we understand what happened to us, and because that's the kind of videos people seem to want to understand more, and yet not feeling like, yeah, I'm dogpiling on the number of people who struggle and or moms, because that's not what I want to do. But I also know that a lot of the wounds we have, I firmly believe that the majority of the things people struggle with start and originate inside the walls of their own home. As much as society and culture and the world and gender, all of those things, and race and economic status are incredibly impactful. They all impact us. But it starts with all of those factors, how those play out in our own homes. And until we're honest about that and hopefully move towards an area to provide more support, I don't know how that changes. And I would like to figure out how to build some kind of supportive community. I haven't figured that out yet, but I am thinking about it. Anyway, this is a long intro, so I'm sorry for that. But I was struggling this week and I wasn't going to continue the series. And so I wanted to just share some of that with you. So what I want to do is summarize a good part. This may take a couple videos, especially with my long intro now, on chapter 2, All Grown Up, where this book talks about the experiences of children raised by, and I'm going to keep saying it because we're talking about people that usually have no awareness of the diagnosis and no support or no treatment, or they're not interested in getting help particularly. That's what we're talking about. So that's why it also feels really, I think, negative, because we're not talking about the people who get, therapy, go to DBT programs, who work on their parenting skills. And that is really shifting now in the borderline community. A lot more awareness, a lot more support, and frankly, a lot of great treatment in comparison to the past. A lot of really helpful emotional regulation treatment and things like that. So the first thing is it talks about chaos, and it says, since they, meaning people with borderline, since they don't have a strong sense of identity, people with BPD may simultaneously fear abandonment and engulfment. Hence the I Hate You, Don't Leave Me, which is a book that's very common around this disorder. In the interviews we conducted, adult children tell of growing up in a confusing and unpredictable world. They rarely knew what to expect. They'd either be praised or berated, hugged or brushed off, smothered or neglected. Some wondered from hour to hour what they should be thinking or doing to gain their parents' approval. So the contradictory behavior, the chaos, and a lot of crises from one minute to the next are often the things that parents are struggling with. So they're often creating this world for themselves. At times it's chaotic. The child is trying to manage how to respond to mommy, daddy, parent when they're in this state. And it says, because of borderline's cognitive distortions or perceiving a reality altered by their own idealizations and projections, parents with BPD see themselves differently than they actually are. They see themselves as caring and nurturing when they may have been indifferent or cruel. They may see themselves as the perfect parent, homemaker, or provider. They may not have an inkling as to how their actual behavior is affecting those around them, or how confusing and chaotic these distortions are for children. So then the book goes into talking about the lack of predictability. And this is really important as I talk about hypervigilance, that many of us learn that the way to navigate the lack of predictability and the eggshell behavior was to seek refuge somehow, some way, somewhere, knowing that things like cabinet slamming, deep sighs, the sound of the car in the garage door slamming shut, all of those things might mean something. Now, this might be true for lots of parents who also do not have borderline, but it is a very classic thing for borderlines to be actually really good at overreading people and interpreting, and not necessarily being accurate, but making meaning from it. And then from us as their children to learn over time pretty quickly that this set of sensory responses or nonverbal behaviors are going to mean something. And so it says the effects: escape from reality. As a result of the unpredictability, children of borderline parents often find a physical or psychic place to retreat, to the bedroom, a closet, or a rich imaginary world that they create. Adult children report missing chunks of memory. They look back and wonder what they did with their time. They may and may continue to dissociate or zone out for periods of time ranging from a few seconds or even a few hours. One woman raised by a borderline parent who went from an all-loving to a screaming, yelling, bitter, angry, rageful parent, like someone carrying a hand grenade. You never knew what to expect when the pin was going to be pulled out. Says her dissociation is a repercussion of growing up in constant fear of her mother's explosions. I froze my emotions. I didn't allow myself to feel. My major way of coping was saying, this just isn't where I am. I did it to such a large extent that I missed out on a lot of what happened in school. A large part of my childhood is just blank. And this is actually really common. The combination of rage and quick to anger for borderline parents and our tendency to engage in all kinds of forms of dissociation, from spacing out to maladaptive daydreaming to building these rich imaginary worlds with characters or ourselves, how we were going to change our future life. I can remember just hours on road trips. Obviously back in the day too, in the 70s and 80s, where there was no, video in the car, looking out the window and just losing myself and playing out the story of what my adult life was going to look like. And so we can get lost in this fantasy world. We can have a tendency to idealize people and situations, much like our parents might do. And it can be really difficult to look at your life from the real lens that you're struggling with when you have that, what I've talked about, the disorganized attachment, which is very common with borderline, where the parent is the source of security or safety and also the source of fear. And so you have this thing where the person who's most supposed to keep you safe is also the person you're most afraid of. And because of the often shifting of idealization versus devaluation, the common splitting, and the fear of engulfment, and sort of the fear of, being too close to somebody, as a child, you internalize all of those experiences yourself. And you're getting what I call the good love and bad love. And I know that's not necessarily the best way to describe it, because people will say, well, is that even love? But I really do believe, regardless of how you judge it, that people who have difficult mental health issues are in their own version of love. It may not be a safe form of love, but to them, they would say that they love their children, their partners very much. So I understand that, and please understand that I know that that is not what healthy love looks like, but it doesn't take away from the fact that they feel this way. And so they're struggling with managing all of those emotions inside. And so what it says is that as adults, this idealization may manifest for us in unrealistic demands on others, including friends, sons, daughters, and partners, and unrealistic expectations of relationships. And so we can expect perfection because we expect perfection of ourselves, and so can the parents. So there can be this overlap between their difficulty and how we interpret that. And I just realized today it's going to be a little bit difficult personally, but I do want to make some videos about having moms who struggle like this. And this includes narcissism, immaturity, and borderline, and how that can play out in our female friendships, especially in our adult lives. So I might do that next. So then it talks about abuse and neglect and fears of abandonment. It talks about the different levels of post-traumatic stress, of PTSD, which I would argue this book really predates the concept of complex PTSD, but you can also have obviously specific traumatic events in time, single traumatic events, and a repeated experience of, which I think is very common, of complex trauma. So you as a child may be holding PTSD symptoms and complex PTSD symptoms. Now, let's get into a few more things that I think are really common, and then I'll go to the next. This video is, I know, getting kind of long. So then some of the most common things the book talks about are what comes under the category of boundary violations, which include things like enmeshment, parentification, and invalidation, and role reversals it goes into after the boundary issues, the walking on eggshell effects. And so let's just discuss those a little bit. One of the issues those with borderline have is understanding the role of the child and the parent. And so it's not that you can't have some friendship there, But oftentimes I think because of their own fears of abandonment, which is the core of borderline, having a child almost to them can feel like, now I have someone who will always love me for me. And that can make it difficult, especially as the child grows and develops and tries to separate, to understand that the child does not exist as a partner or a therapist or a best friend. The child is supposed to be a child. And so what can happen is, it says this: because the parent has such a blurred sense of self in relation to others, enmeshment or emotional entanglement is common. Borderline parents may treat their children as an extension of themselves, almost like one of their limbs, expecting them to wear the same clothes, hold the same opinions, or to side with them in disagreements. And then it talks about boundaries in terms of the parents can be triggered by any kind of boundary. And so it says this: each time a child knowingly or unknowingly asserts himself or herself or calls attention to the boundary between the self, the child, and the parent, it may trigger feelings of rejection and abandonment in the parent. So that's a real dilemma, right? A child is supposed to, as they grow, pull away and create more of a sense of self. And this, we really see this happening in the tween and teen years, which is part of preparing them for leaving us. And it can be painful for them and for us as they start to push back and maybe challenge things and tell us, like, you don't know everything. And we pretty much start to see more and more that we don't know everything, and that we have lessons to learn and traumas ourselves. That can be really threatening if you're, whoever you are, if you have an issue with the idea of separation of child and yourself. And so it can feel very personal, very hurtful, and very triggering. So as opposed to seeing a child's teenage behavior as a separation behavior, which I do believe is helpful, it feels like a personal attack. And that can trigger all the fears, and then the lack of boundaries can create, and the impulsivity, the perfect storm for a lot of difficulty and fighting and chaos, especially during those years. The next part where I'll stop today goes into this idea of walking on eggshells, which I talk so much about, eggshell parents, which I do believe are often borderline, untreated borderline, narcissistic, and or what we call emotionally immature parents. And it says that basically we have these experiences of invalidation, of role reversal, identification, and that we can really start to struggle with things around how we look, how we show up, and perfectionism and our own awareness. And so that's the heart of this book. There's so much more in this, and this chapter is really full and rich with a lot of qualities that are important to understand. But we're going to start the next video talking about transference and borderline parents, and then we're going to go into anger and patterns of attachment, and what the book talks about as what it takes to the seeds of building a healthy relationship and child. And then it provides a few journal exercises I will share with you. So that is really what we're talking about today, is just understanding that everything I mentioned in the last few videos, it kind of goes further into and talks about what those things look like for you. And I think at the heart of this, it is incredibly validating for us to know that a lot of the things that we struggle with in our adult lives, in our relationships with ourselves, our families, our friends, our children, our partners, is oftentimes built as our, as I've said, armor or response to not having a consistently safe, emotional, at a minimum, relationship at home. And I don't care how great your parent is, I don't care how loving they are, like I keep saying, if you know that they might be loving today, but tomorrow, rage at you, accuse you of things, attack you personally. Frankly, some of the worst experiences I have had with my own mom came in my adult life when I had children. And of course, I've blocked out a lot of the childhood things, but there was a definite shift. And I think where the most hurtful things happen, they really were as we were two technically adult women. I say technically because I never felt like it in that relationship. You can feel like a child your whole life because they don't let you be a child. And in that kind of boomer generation, it's like, you must respect me at all costs, I'm the parent. It's like, yeah, but I'm 40 and you're 65 or whatever. And so that's where it gets difficult. So we're going to keep going. I'm going to try to do the whole book. I think I can. I might have to start shortening these videos and summarizing so this doesn't take 20 videos. But maybe I'll go through and find the most helpful things as I keep going. But I thought that this chapter does have some really good stuff in it. The next chapter after that one is talking about grieving a lost childhood, which I also think is incredibly important as we look back on these childhoods and so long for things to be different, and yet know that that will never be. So I hope this is helpful and validating. Thank you so much for your kind, beautiful comments and for being here. I do appreciate you, and I want you so to feel understood and seen, and I hope that you are having that experience here. So thank you so much. Please consider subscribing if you're new and sharing your thoughts if you feel safe enough to do so. And I will see you, I guess it's Friday now, so I will see you on Monday. Have a great weekend. Stay safe and take good care. Bye. Just dropped my book. Bye.
Thank you.